What you need to know about your colonoscopy appointment. What is a colonoscopy? A colonoscopy is a test to check inside your bowel. A long, thin, flexible tube with a small camera inside it is passed into your bottom and carefully moved around for a closer look. A colonoscopy can help find cancer at an early stage when it's easier to treat. It can also help find changes in the bowel, such as non-cancerous growths called polyps. Most polyps can be removed, and this can prevent bowel cancer from developing. How do I know if I need a colonoscopy? After doing your bowel screening test, you'll get your results in the post. If further investigation is needed, you'll be invited to a colonoscopy appointment. You will likely be contacted by a nurse to discuss your appointment. This is called pre-assessment. Details of your appointment will come in a separate letter. If the colonoscopy appointment given to you isn't suitable, please phone the number on your appointment letter as soon as possible to rearrange it. How to prepare for a colonoscopy. You will receive all the information you need on how to prepare for your colonoscopy before your appointment. The information will tell you the food and drink you should avoid on the days leading up to your appointment. You'll also be told if you should stop taking any of your regular medication. You'll be asked to take a laxative. You'll be given instructions on when to take it. You'll need to think about what you're doing the day you take the laxative, as you will need to go to the toilet frequently. You'll be given advice on and the option of pain relief and medication to help you relax. This is called a sedative during your colonoscopy. Sedatives may affect you for around 24 hours, so you'll need someone to take you home if you do decide to take this. What to expect on the day of your colonoscopy. Your appointment will take place at a hospital or a community clinic. Before the colonoscopy, the nurse will explain what's going to happen and tell you about any risks. You can ask any questions you have. You'll then be asked if you're happy to go ahead with the procedure and confirm your consent before changing into a hospital gown in a private space. If you choose to have sedation, you'll be given it at this point. A colonoscopy takes about 40 minutes. A nurse will always be with you to make sure you're comfortable. When you're ready, you'll be asked to lie on your left side with your knees slightly bent. The nurse or doctor will then start by inserting their finger into your bottom to check if there are any large hemorrhoids or growths. Next, they'll put the endoscope into your bottom so they can look in your bowel. Gas or water will then be passed down the endoscope, making your bowel bigger, which makes it easier to see. This may make you feel slightly bloated, and you might feel the urge to go to the toilet. You won't go to the toilet because your bowel will be empty, but many people passed wind during this test. This is normal. If you have polyps, your nurse or doctor can remove these. If they are big or in a difficult position, you'll be given another appointment. You may be asked to move position during the colonoscopy. Your colonoscopy results. Once the colonoscopy is finished, you'll be taken to a recovery area. The nurse or doctor will speak to you about your results and any follow-up appointments or medication you may need. You'll then be offered a snack and a drink before you leave. Once you feel well enough, you can go home. You might feel slight discomfort for a few hours due to some trapped wind. If you take sedation, you'll need someone to take you home. For more information, visit www.nhsinform.scot/bowel screening.